Hello, this is an information session broadcasted from the Ministry of Health and Long-Term Care. This message is directed towards paramedics with the intention of instructing them on past mistakes in regard to worker safety and infection control. The intention of this broadcast is to teach you, paramedics, how to properly use the personal protective equipment that will be supplied to you in your workplace. This message is written in blood, meaning we are learning from previous mistakes. This message is coming in the form of a podcast to ensure that you are able to view it while at your station in your workplace.
Severe acute respiratory syndrome, also known as SARS, is a virus that had devastating impact on the Ontario healthcare system. In Ontario alone, 44 persons died as a result of the virus, the largest percentage being healthcare workers. The failure of the occupational safety and infection control system led to a lack of preparation and an inability to respond effectively to the crisis. Due to a lack of safety systems being in place, we sacrificed workers' health and safety when asking them to come to work and treat patients. The best practices and principles for worker safety were not in place. In order to prevent this from occurring again in the future, Ontario needed to focus its resources and increase awareness concerning infection control and healthcare worker safety, specifically paramedics. It is recommended that we need to give workers the right to the precautionary principle, or be safe, not sorry, rather than wait until science confirms a threat exists. Through development of communication, protective equipment, increased knowledge and accountability, Ontario was able to successfully respond to the outbreak of H1N1.
Before SARS, there was no system in place to deal with a major health crisis. Specifically, paramedics were not equipped with proper personal protective equipment or with the knowledge needed to keep themselves safe. Workers were torn between staying at home or going to work and putting their families and loved ones at risk.
Prior to the SARS outbreak, you were only provided with gloves. Many of you did not know how to properly use them or know the risk associated with a lack of protection. There was no health and safety culture at the time connected with worker safety infection control.
Prior to SARS, N95 masks were not mandatory and you were not fit tested to ensure that you were protected. Also, the masks that we provided were not resistant to all pathogens, which posed a safety risk. Personal protective equipment at this time meant gloves and a mask that was not properly fitted to each individual.
Post-SARS, we have worked extremely hard to try to make equipment available to you at your workplace to keep you safe. You will now be provided with a PPE bag, which will include gloves, glasses, a fitted N95 mask, and a fitted helmet. You will be instructed on how to properly use each piece of equipment, as well as the reasoning behind it. This system is also implemented to create accountability. Supervisors will be checking your personal protective equipment bag to ensure that all the correct equipment is included on an ongoing basis.
These pictures illustrate the difference between systems in place pre-SARS and post-SARS. On the left, it shows that gloves were the main protective equipment in place, which most of you were not made aware of how to properly use. On the right, we have updated standards, which include gloves and glasses, which should always be used. The N95 masks are used when deemed appropriate or when at risk.
Prior to SARS, there was no available body protection. We have now implemented a suit that you will be required to wear when there is increased risk.
As workers, you have the right to the precautionary principle. This means that you should not be affected by lagging indicators. We would like to move into a system based on leading indicators for your protection. We have introduced a respiratory assessment model that allows an early identification of risk. When entering a situation, there are a series of steps you need to take. If the patient has 2 of 3 of these indicators, shortness of breath, elevated temperature, or has visited a foreign country in the last 24 hours, you need to move into a protective state where you will use your N95 mask and possibly the bodysuit.
These are the materials that will be included in your personal protective equipment bag.
Prior to SARS, safety was not a priority. We have now installed sanitizing stations in all trucks and areas of the hospital. You are expected to use this on a regular basis to protect yourself as well as those around you. Using this hospital-grade disinfectant will significantly reduce the risk of passing on a pathogen to someone else.
As well as sanitizing, you are expected to wash your hands properly and use the techniques instructed. This will not only impact you, the worker, but also the safety of those around you.
Prior to SARS, there was no system in place to protect the worker. We now have a joint occupational health and safety committee in place. Please seek out more information to do with this committee and how they can serve you, and how they act to ensure your supervisors are accountable for their actions.
There is no excuse not to have the maximum level of protection. We have provided you with the proper equipment and instructed you on the protocols on how to use them effectively. As well, there is a large supply available to meet the possible demand we could have.
When moving into H1N1, we were much more prepared for the possible outbreak due to the changes we have made. We have increased communication with the public and healthcare workers like yourself. You now have the required material to protect yourself and the knowledge of how to use this equipment properly. And we have also have better use of the precautionary principle through not waiting for scientific certainty to effect changes with regard to safety. We are putting these systems in place that ensure infection control, surveillance, and safety.
If workers are not protected from health and safety hazards, patients and the public are not protected either. It's that simple. We have provided the equipment and knowledge necessary. It is now up to you to follow these guidelines for your safety. Remember, you can keep your employer accountable for their roles through the Joint Occupational Health and Safety Committee. For more information on these materials, or if you have any further questions, please speak to your supervisor or contact a member of the Ministry of Health and Long-Term Care.